everyone, it's me again. I'm Lena and I'm from the Healthcare Landscape Group. In this video, I'll be talking about my third DE, which is on the topic of the treatment success rate part 2. Now, this is the DE3 week 80, and in this video, we are going to go over the 2 problems that Mrs. Pratt gave out to us to do in this week 80. Now, the first problem is the treatment success rate equals the number of patients who successfully completed the treatment divided by the total number of patients who started the treatment. So I've written it here times 100. The first question is, please elaborate this formula based on the numerator, denominator, and the percentage. So what I think that Mrs. Pratt inferred by saying that elaborate this formula is that I think that I need to explain about what the meaning of the numerator is. In this case, what parts include the numerator, and this applies for the denominator as well, and what is the percentage. So let's start first with the numerator. The numerator. So remember, the numerator is the number at the top. So the number of patients who successfully completed the treatment. I feel that the cured, the category of cured and completed treatment is the number of patients who successfully completed the treatment. So let's look at this chart which is attached to the D3. Firstly, for the cured and the completed treatment, I think that the cured is about 140. I think the cured is 140 patients, and then the completed the treatment is 100, and this all adds to 340 times 100. This will equal about, not exactly, it's a decimal, which is very long, but this is about 70.5%. So that is one example. It also applies for B. That is my example for B, and that is the success rate of the treatment in patients. Now, the numerator is the number of patients who successfully completed the treatment. In this case, this includes the cured and the completed treatment. So that is the number of patients who successfully completed the treatment. And the total number of patients is, we take all the categories, include the 6 categories, combine them all together, and we have the denominator. So this is, we are finding the percentage of these 2 categories combined. Let's check for reasonableness. So I estimate it to be around 70.5%. Now, my measurement isn't exactly correct because I use my skills, my eye, to estimate the number of patients in each category. So it's not exactly correct, but let's see if the chart says so. 41.0% plus 30.9% will equal 71.9%. Now, I see that 71.9% is close to 70.5%. So I think that my answer is close and is reasonable for this. And so that is an example needed to be presented too. And I've already presented the example of the cured and also the completed treatment, which is the number of patients who successfully completed the treatment. That is the success rate of the tuberculosis treatment in patients. So here, tuberculosis treatment. All right, that is for the problem 1. Let's move on to problem 2. Now, problem 2 is not exactly involving like direct mathematical terminology, but it's more like analyzing charts in an IELTS band 1, the IELTS band 7 writing skills for task 1 to analyze the chart which is attached. So, okay. This ripped a little, but I think that we can still see it. Alright, so Here's the D3 week 80 here. That is for problem 1, A, B, and then for problem 2. Now, problem 2, the bar chart illustrates the efficacy of tuberculosis treatment among patients, presenting the percent distribution across 6 distinct categories: cured, completed treatment, treatment failure, lost to follow-up, died, and not evaluated. Overall, it is evident that the most significant proportion of patients achieved positive outcome with a total of 71.9%, which either cured or completed treatment. Conversely, which is in contrast, a small percentage of patients experienced negative outcomes such as treatment failure, lost to follow-up, or died. So based on the graph, I just based on the graph and did my for my second problem. So that is the introduction. The introduction and then the summary. It's a summary, not a conclusion, because the conclusion is for task 2, which is usually giving your opinions on that, your view on that. But for task 1, we're only giving what we see, the data that we interpreted, not our opinion. That is for task 2, but this is for task 1, which is interpreting the chart. Okay, so that is for the introduction, the summary, and then for the main paragraphs, 2 body paragraphs. So this is about the positive outcomes, and this is negative outcomes. Okay, so for the positive outcomes, specifically, the highest percentage was recorded for the cured category at 41.0%. This is followed closely by completed treatment, which accounts for 30.9% of all the patients. Together, these 2 categories represent a notable majority of patients who successfully completed their tuberculosis treatment, adding up to a total of 71.9% out of 100%. Okay, so this is the last paragraph. This is the negative outcomes. Okay. Among the less favorable outcomes, lost to follow-up stands at 12.7%, indicating a marked challenge in maintaining patients throughout the treatment duration. Not evaluated was surveyed at 5.2%, while died is recorded at 9.9%. The smallest proportion is treatment failure at a mere 0.3%. So what we learned from this graph, from what I analyzed in my second problem, I can see from this chart that the majority of outcomes, the majority of patients achieved positive outcomes. However, there are still some flaws in the tuberculosis treatment, leading to died, treatment failure, lost to follow-up, and not evaluated. So not evaluated was neither positive nor negative. So it's a different part on its own. But I think that the cured and the completed treatment was the positive outcomes, and the other, except for the not evaluated, was the negative outcomes. And thereby, from evaluating this chart, I can give the conclusion that the majority of the patients who have the tuberculosis treatment achieved positive outcomes. And yeah, that is all for my Daily Edition 3 weeks 80 on the treatment success rates part 2. Thank you for listening to my video. If you have any other questions, any other ideas, opinions to add into my video or hopefully improve it, then I will be glad to hear them all. Thank you again for listening to my video, and I'm looking forward to see you soon. Goodbye!